Good morning, everybody. I hope you are all very well. Today, I am continuing my 21-day challenge on head-to-toe management of your baby's minor ailments. So today, I am going to be talking about tongue tie and lip tie. Now, what is tongue tie? Okay, so we have children who are born with tongue tie, and the percentage is about 1 in 10. So it's actually quite high. Now, what it is that the tongue is tethered to the base of the mouth by a membrane called the frenulum. Now, this can be anteriorly tethered or posteriorly tethered to the base of the mouth. Now, if it's a posterior tongue tie, there probably won't be too many implications with breastfeeding or bottle feeding. But if it is an anterior tongue tie, that means that the tip of the tongue is tethered to the base of the mouth. Now, the way that you will notice this is that your baby won't be able to stick their tongue out beyond their bottom teeth. So like this, it'll be quite tight, and they won't be able to move their tongue from side to side like that. So these are the types of things that you need to be looking out for. Sometimes when they poke their tongue out, you'll see that it's bifold, kind of like a heart shape, where the tongue is just really being pulled back and causing the tongue to form that characteristic heart shape in the baby's tongue. Now, when I trained as a children's nurse, they used to check the baby from head to toe. They still do that as part of the discharge plan. And what they would normally do is look under the tongue to make sure that there isn't a tongue tie present. It's called the newborn screening examination. However, a lot of these examinations are being done by very junior doctors, and they are often forgetting about looking under the tongue to pick up a tongue tie. So the baby goes home without this ever being detected. Now, again, they used to deal with the tongue tie there and then in the hospital. When I trained back in the 80s, they used to snip the tongue there and then before the baby went home, but they've stopped doing that practice now, which I personally think is a bit of a shame, because it's proactive to be able to deal with these things before the baby goes home. Unfortunately, though, the practice now is to wait and see if your baby develops any feeding problems. Now, that is a real shame, isn't it? Because breastfeeding in itself is quite tricky sometimes. And if you have got a baby with tongue tie, it's certainly going to make it a lot more trickier. Now, it will cause problems for both the baby and the mother. So for the baby's going to have real problems in latching on because they're not able to pull the areola back to the soft palate at the back. So what they're doing is they're sucking on really the nipple, which is going to be causing a lot of pain and discomfort for the mother. But because they get really tired trying to pull the breast tissue backwards, they come off the breast all the time. So they don't get that hind milk, which is really important for baby to grow and develop, because we have the foremilk and the hind milk. And the foremilk is kind of like semi-skim milk, whereas the hind milk is the bursting stuff that's full of nutrients. So what will happen for your baby is that because they're just taking little and often, they often fail to gain weight, and in actual fact they can lose some considerable weight, which can be really distressing for the mother when she's doing everything in her power to be able to be successful in breastfeeding her baby. Another little sign that you'll hear is when your baby is feeding, you'll hear a kind of clicking of the tongue because they're trying to get a suction, but they keep on losing the suction. And there'll be a gape between the tongue and the cheeks almost, so they're not forming a seal. So that leads to biting of the mum, really, which is very difficult as well. So because the baby can't get a proper latch onto the breast, this causes considerable problems for the mum, and often because of them not being able to draw the breast tissue right back to the soft palate, they end up, as I said, sucking on the nipple, which will cause bleeding and cracked nipples in the mother. But not only that, you will get signs of mastitis. Now, mastitis happens because the breast ducts aren't being emptied effectively and efficiently, so the milk builds up in the breast ducts and it becomes inflamed, red and swollen, and it is quite a painful thing to be dealing with. So if your breast tissue, the skin, is showing any signs of redness, or if you have lumpiness in the breast tissue, you really do need to take early action. Now, you can manually massage the breast tissue and get rid of the excess milk. And indeed, you can keep this milk and offer it to your baby through the bottle. It might well be easier for them to take the milk, your breast milk, through a bottle than it is for them to latch on to the breast themselves. But this is not ideal, of course. Now, because mastitis can go on and develop into an infection, you may need to have antibiotics to deal with this. So you'll need to go and see your GP if you become unwell, signs of a high temperature, sweating, that sort of thing, because that means that the mastitis has turned into a bacterial infection. Now, don't worry too much. You can still breastfeed when you have mastitis. I certainly did. And that's the best thing to do, really, because the engorgement will just continue if you don't allow your baby to breastfeed. I wouldn't express using an electric pump too much, because that can sometimes overstimulate the breast and cause the problem to be worse. So tongue tie is quite, even though it's a minor ailment, it can have real knock-on effects for the baby and for the mother. So what do we do about it? Well, you can go to a lactation consultant, and they deal with breastfeeding problems. And many of them are private practitioners that can do this division of the frenulum quite quickly and quite easily within their own practice. You can also get your health visitor or GP to refer you to an NHS hospital that carries out tongue tie division. The thing about that is that you might be waiting for some considerable time, unfortunately, which is awful, because you want to be able to sort the problem quickly and effectively. And sometimes your only option is to pay for it, sadly. But it will need to be done if it is affecting your baby's weight gain. So you can look these up in your local area, and I'm not quite sure how much they charge these days. That's something that I'll have to research into a little bit more. So that is tongue tie. Now, a lot of parents ask me, is it painful for the baby when they release the tongue? Now, I have heard of babies who actually sleep through the procedure and don't really notice that it's happening. The thing that distresses them the most really is being swaddled, so they are tightly bound so they can't kind of lash out, and they just use a sterile scissors or scalpel, and they just release the membrane under the tongue, the frenulum, and the earlier they do it, the better, in my opinion, because as the baby grows older, the frenulum can get a little bit thicker. Now, there is a train of thought that sometimes a tongue tie can get better as the child grows older. And indeed, there's many children going around with tongue tie, and the worst that happens to them is that they might not be able to lick an ice cream in the future. But tongue tie is also associated with speech and language problems, particularly if it's an anterior tongue tie where it's quite tight to the base of the mouth. So these are the kind of things that you need to think about when you're thinking about the pros and cons of releasing a tongue tie. So let me just briefly talk about lip tie as well, because this is also something that can affect bottle feeding and breastfeeding. And it's just here at the top of the lip where it's tethered to the gum. And again, this can cause feeding problems, but we don't tend to release those as much. In fact, many children and indeed parents release them inadvertently when babies shove things into their mouths, or parents feeding their babies, they tend to release them, you know, by mistake. So I'm not going to dwell too much on a lip tie. But tongue tie is something that can cause a lot of distress for the baby and the mother because of all of the reasons that I have mentioned. Okay, so this evening I'm actually going to be going live in my private Facebook group talking about breastfeeding in a little bit more detail. And if you want to join me there, please do come on over and join the group. I will put the link in the comments. If you have found this video useful, please do give me a like or comment. Ask me any questions that you would like on that, and I am happy to answer them. Until tomorrow, I will be going live at 9:30 again over in my group, continuing my head to toe of minor ailments in babies. Hopefully I'll see you there. Have a great day, everybody. Bye-bye.